smell of Fob Carver's aid station was antiseptic, and burnt coffee, and the particular dry heat that settled into canvas after 3 weeks without rain. I know that smell the way I know my own hands. I was there the morning they told Corpsman Dara Voss she wasn't a medic anymore. Not officially. Not in writing, but in the way that counts in a forward station. Out loud, in front of people, with rank behind it. Had come in for a redress on a fragment wound. Nothing serious, sitting on a cot, near the door while Voss finished a consult on a Marine 2 beds. She was calm about it, the way she was calm about everything. Not the calm of someone who doesn't care, but the calm of someone who has already done the calculation and knows what matters. She was recommending a delayed closure on a wound that looked clean but wasn't. She'd seen something in the tissue. I couldn't tell you what. I'm infantry, not medicine. Major Reeves came through the partition before she finished the sentence. He was the battalion surgeon, competent, overworked, 3 stations with half the staff he'd been promised. I want to be fair to him. He was not a cruel man. He was a tired man who had a system, and Voss did not fit his system. And on that particular morning, with 2 other cases waiting and his patients at its floor, he made the decision to say out loud what I suspect he'd been thinking for weeks. Corpsman Voss. His voice carried across the whole station. You are not a physician. You are not a PA. You are a supply runner with a kit, and I need you running supplies. He overrode her recommendation. He ordered the wound closed. He did it without looking at her again after the first word, which is its own kind of dismissal. The station went quiet the way rooms do when something ugly has been said clearly and no one is willing to challenge it. Voss didn't flinch. She didn't argue. She handed off her notes, said, "Yes, sir," and went to the supply locker. I watched the other corpsman look at the floor. I watched the Marine on the cot look at the ceiling. I pulled on my jacket and walked out thinking the major probably had a point. She was young. She was forward of where a corpsman usually worked alone. There's a reason the certifications exist. I want to be honest about what I thought. I want to be honest because of what happened 6 weeks later. The IED that took out the vehicle convoy hit at 14:30 on a Tuesday. I know the time because I checked my watch before the blast, and the watch stopped working after. 3 vehicles. 16 personnel total. Major Reeves was in the second vehicle. He was alive when they pulled him out, but he wasn't going to be running a station for anyone. They brought us to Fob Carver's aid station in the first 15 minutes. I was on a litter, in and out. One lung not doing what lungs are supposed to do, and what I remember of the next hour comes in pieces. The canvas overhead, the sound of equipment, particular quality of a voice that is working and not panicking. That was Voss. She had the station running before I understood what was happening. I heard her call the triage order, critical immediates to the 2 open tables. 4 urgent immediates staged for prep. 2, she was managing herself, while she directed the other corpsmen. She was the only one certified for the trauma protocol the situation required. I know that now. I half knew it then, half conscious and listening to her voice cut through the noise like a blade through canvas. Clean, no excess, nothing wasted. At some point she was standing over me, pale. She used my name the way you use someone's name when you need them to stay present. I'm going to place a chest seal. You're going to breathe easier in about 30 seconds. Don't move. I didn't move. She was right about the 30 seconds. What I saw from that cot, what I was able to see, was a woman running 9 separate critical cases with a staff of 3 corpsmen who had never worked a mass casualty event without a physician present. She called every step aloud, not for her own benefit, but for theirs. So that when she moved to the next table, they could continue without her. She was teaching and treating at the same time, which is a kind of competence I had no frame for until I watched her do it. Procedure she was not qualified to perform. The one Reeves had told her specifically, with his rank and his 6 words, she was not cleared to do. She performed on the Marine from the 3rd vehicle, the one whose wound had been wrongly closed 6 weeks earlier because of that same conversation. The tissue had failed, as she'd predicted. She opened it, cleared it, and managed it correctly in 11 minutes, talking the most junior corpsman through every step without once suggesting it. Anything other than routine. I was watching. I want to be clear that I was watching. She did not ask for permission. She did not announce what she was doing or explain herself to anyone in that room. She simply did what the patient required because she was the only person present who could do it. And she had known that since before any of the rest of us arrived. The brigade surgeon came through the door at the 50-minute mark. Colonel Whitfield, older man, combat tours going back further than mine. He stood in the doorway and looked at the station. 9 patients, 9 critical intakes, every one of them stable. He walked the room quietly, the way a man walks when he is looking at something he is not expected to see and is trying to understand its dimensions. He checked each patient in turn. He reviewed Voss's documentation. She had charted every procedure, every decision, every timestamp, in handwriting that I could read from 2 feet away without my glasses. Complete, ordered, nothing missing. He found her restocking the supply shelf at the far end of the station. She had her back to the room. She did not hear him approach, or if she did, she didn't turn. He waited until she turned on her own. Then Colonel Whitfield, brigade surgeon, 23 years in uniform, came to attention and rendered a formal salute. He held it. The whole station saw it. The 3 corpsmen, the 9 patients, me on my cot with a chest seal and enough function to sit up. We all saw it. Voss looked at him for a moment. Then she returned the salute. Correct, unhurried. The same composure she'd had at 14:30, when the litters started coming through the door. The same composure she'd had 6 weeks earlier, when a tired major had reduced her in front of her peers. She returned it and then went back to the shelf. Whitfield said one thing. I was close enough to hear it. Outstanding work, Corpsman. That was all. She nodded once and kept working. There was nothing in her face that looked like triumph, because this was not triumph to her. This was just the work. The work she had always known how to do. The work that had been waiting 6 weeks for someone with sufficient rank to require it of her. I've thought about Major Reeves a lot in the time since. He recovered. He went back to a stateside posting. He was not a bad surgeon, and I don't think he was a bad man. And I genuinely think, that if you had asked him that morning whether a corpsman with Voss's training was capable of running that station alone, he would have said no, because he had never had reason to believe otherwise. That's the part that stays with me. Not the salute. The salute was Whitfield correcting the record, and the record needed correcting. Stays with me is the 6 weeks between. 6 weeks that Marine walked around with a wound closing wrong. 6 weeks the station deferred to a chain of authority that was missing one critical fact about who was standing in that room. 6 weeks Voss ran supplies and said nothing, because there was no system for saying it. And she wasn't going to spend herself on a fight she hadn't been given the standing to win. She waited. She did the work she was given. She kept her certification current, and her knowledge sharp, and her hands ready. And when the moment arrived, she was exactly what she had always been. I think about that sometimes when I'm inclined to assume I know what someone is or isn't capable of. I think about a woman standing at a supply shelf at Fob Carver, with her back to a room full of people who had just watched her save 9 lives, turning a salute like it was the most ordinary thing in the world. Because for her, it was. The extraordinary part had happened at the tables. The salute was just someone else catching up.